CHW Day is almost here, so what does a community health worker do? Our expert, Devon Abdon, is here to chat about his journey to the public health field, the important roles a CHW can play in our communities, and how he remains optimistic in the face of challenges. And later, because CHWs are modern-day superheroes, we decide what our superpowers would be. Some will benefit humanity, and others maybe not. All of that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson here alongside Angela Ta and Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health, coming to you today from Memorial Hall in downtown Columbus. Angela, how's it going today?
Really good. Thanks for asking.
And Zach, how are you today?
No comment.
No comment.
It's none of your business.
Okay. Well,
Keep that to myself, please.
Zach's playing it close to the vest today, and that's fine. That's fine. We'll see how he's doing as the show progresses. Hopefully we get a little bit more info out of Zach.
Probably not.
Probably not, but we can dream. We can dream. But we are excited to have our guest today, Devon Abdon, Care Coordination Supervisor at Franklin County Public Health. Devon, how are you doing today?
I'm not sure yet, but it's good to be here.
Okay.
Great answer.
We've got two on the fence right now. Hopefully we can get them on the good side. Devon, so I just wanted to get a little bit of background about you and why you are working in public health, how you got here.
Yeah. I wish I could say it was like a lifelong dream of mine. This is what I went to school for, but none of that is true. So by the time I graduated high school, I was already struggling with an addiction, and I joined the Army as a way to try and fix that. After basic training, I went overseas. When I came back home, nothing was fixed, and it got a lot worse. So I struggled with addiction for most of my adult life until about 7 years ago when I came to Ohio. Moved to Columbus and went through a Christian ministry for guys that struggle with addiction. I completed it. And during that time, I became a CHW, community health worker, working in the community in the safe sleep space. And I got lucky and landed a job here at Franklin County Public Health. And so that's why I'm in public health. I joined at the end of 2019, and probably 2 months in, COVID-19 was my introduction to this sort of career that I fell into. So really got to see the inside. I really got to see what public health is all about. And I never left.
Absolutely. And, we also talked on the podcast with Cassie Baker, who has some experience sort of in this world as well. Maybe can you describe for someone who may not be familiar with the term community health worker, what a CHW does?
Yeah, absolutely. And I think I could start by saying community health worker is a title that many recognize, but nationally, outside of the U.S., CHWs also go by different titles, promotoras, health representatives. So there are many different titles for community health workers, but a CHW is really a frontline public health worker. And where they are unique and where one of their main skill sets lie is they're representative of the communities that they serve. They have trusted relationships with these communities. They share similarities, they share struggles, they share backgrounds, they share successes. And in the context of Franklin County Public Health, CHW is all of those things and also serves our residents every step of the way. A lot of times, funding kind of dictates what resources are available across social medical services. But, one thing that's always true is that even if the resources aren't there, CHWs are. And so to me, that's what a CHW is. When nothing else is there, CHWs are.
That's awesome. So, you're sort of describing someone who's really in the thick of it with people, assisting them, bringing them all these resources and connecting them. And that to me sounds like you could become really emotionally invested, right? But like you said, the funds aren't always there for maybe something someone needs. So how do you ride that emotional wave with someone, be in the trenches with them to help them, but also not become super overwhelmed with that as a CHW?
So I think one of the main ways in my experience serving as a CHW here and now as a supervisor working with CHWs, you have to really celebrate the small wins.
Mm.
Um, Unfortunately, there are times when resources are unavailable.
Yeah.
Housing is hard to find. People find themselves living in their cars. People find themselves at some of the most challenging points in their lives. Um, and so to ride that emotional wave, you have to celebrate those small successes, and you also have to know your limits. There's only so much that we can do. There are things that are outside of the scope of CHWs and the work that they can do, but there are things that are inside of it. And so celebrating those small successes really sets you up to kind of use the hard times to grow from. There's a lot of times you're not going to be able to fix everything, but what you can still do is be there for the client. And quite frankly, sometimes you just have to ride the wave. You can't swim away from it. You can't try to swim under it. You've just gotta ride it with someone so that they don't have to ride it alone.
Mm. That's beautiful.
Yeah. And, you stated that you started here in 2019, which was around when I started. And I remember you coming in and everything. I can't remember. Do you remember, Devon? Were we same day? Were we in training together? We might have been.
Man, I don't remember. It was probably, I think, date was September 19th. That's when I started.
Okay, so
if that's a Monday.
Okay, yeah, I'm creating memories. So I was in May, I want to say, was when I was. So but either way, ever since then, I remember the relative size of the CHW team, and it was like small to medium size, and now you guys have just you are a full blown team. It's grown so big. Do you want to talk about what that growth has been like, and especially like as caseloads have grown too?
Yeah, absolutely. To start, that growth has been precarious. It started with one supervisor who's now our division manager, Lindsay Rodenhauser, and one CHW. When we came on in 2019, it grew to 4 CHWs and Lindsay, and then it really started to take off from there after COVID kind of entered the scene, and we got a large federal grant, which allowed to hire for a couple supervisor positions, an administrative assistant, a program coordinator, and 5 more CHWs. So that first grant there was really the stage set for our program, more than doubling in size, opening up supervisor positions. And after that, it continued to grow through state grants, through federal grants, and grants have been the large driver of the growth of this program. So I guess that's why I say it's been sort of precarious, because now we find ourselves, unfortunately, at the end of those grants.
Mm.
And as we work to actively seek funding outside of that, there is the very real possibility that precariousness will kind of come back front and center. But, throughout that time, the growth has to first and foremost be attributed to the CHWs themselves and the work that they do, the skills that they bring to the table day in and day out, with a funding cloud constantly looming over your head to go out and serve people at some of the most challenging points in their lives. That is where the growth came from. Sure, we manage grants, we secure them, we help lead the team, but quite frankly, I think a lot of the growth is due to the CHWs themselves. And I think also, when the program was first created up until today, there has always been a consistent buy-in from leadership here at FCPH. The importance of CHWs is something that has always been recognized. And so I think the work of the CHWs is a main attribute, but also the support from leadership here at FCPH really helped drive that growth.
And also, I want to make note: Community Health Worker Day is June 6th. So we want to recognize that and all the great work that community health workers do. And sort of, piggybacking off what you were saying just a moment ago about helping people at their most vulnerable place. And thinking back on your time here so far, I know there's a lot that I'm sure you're proud of. What would you say is something that you're most proud of during your time here?
That's a tough one. I have to just give it back to our CHWs in general. Just being able to not only be a CHW myself, but now work alongside them as they continue to work in the field. I am continuously proud of them. Day in and day out, they show up. And it's hard. If I had to pick something specific that I would be most proud of, it would be the CHW career ladder that we developed in partnership with senior leadership, our division director, Lindsay and I, and another supervisor who's no longer here, really worked to give the CHWs a career ladder that was attainable, that was meaningful, but that also allowed them to not just have CHW as the only sort of path on their career. You know, there's moved from CHW in training all the way up to CHW2, eventually care coordination supervisor. And so just creating that growth to where CHWs don't have to leave the profession. They can stay CHWs, they can be paid well, they can be supported, and they can grow in their careers right in the very role that they started in.
This episode of Health is Real is brought to you by Graphs. What do you have to say about Graphs, Farmer Joe?
Oh, I love grass. There's Bermuda grass, Kentucky bluegrass, ryegrass, wheatgrass.
Actually, I didn't say grass. I said
lawn grass, goose grass, oat grass, cat grass, fountain grass.
Farmer Joe, that's not what we're asking. We asked you about graphs.
Yeah, like I was saying. Sweetgrass, switchgrass, needlegrass.
No, graphs, Farmer Joe. Graphs.
Yeah, you know, like bar graphs, line graphs, scatter plots, pie charts.
Oh, I love pies. There's pumpkin pies, apple pies, blueberry pies.
That's enough, Farmer Joe. Graphs visually represent data, allowing people to easily see trends and patterns between different variables.
Yeah, they make complex information more accessible and easy to understand.
Oh, I understand. They use visual elements like lines, bars, or dots to depict data, making it easier to interpret than raw numbers alone.
Now you've got it. Graphs. They help us communicate.
And I know you were saying too, you know, that like the funding cloud can be looming, but is there anything that you're hopeful for in the future of CHWs? I mean, you guys do a lot of incredible work. I'm sure there's still some hope at the end of that, right?
Yeah, absolutely. Absolutely. I know the funding cloud thing, it can be a little challenging.
Yeah.
It's hard. It's not easy. But I think something that gives me hope is that CHWs are not new. CHWs have been here, not just in Columbus, not just in Ohio. CHWs have been here for a really, really long time.
Yeah.
There has been a lot of work that's been done before us. And some recent efforts, really some efforts going all the way back to early 70s and 80s at the national level, have really worked to unite this workforce across the country. So some of the things that give me a lot of hope nowadays include the American Public Health Association CHW section, the National Association of Community Health Workers, CHW leaders on a national level fighting for each and every one of us at the local level. This cloud is not just local to Columbus. This funding cloud and this precariousness of this workforce is a national thing.
Yeah.
But what gives me hope is that it's always been like that. Historically, it's always been a challenge, but it's always been addressed. It's always been fought for. To see some of the federal grants, some of the state money, even just some of the support that CHWs are receiving now because of the impact that their work has on our communities, that's what gives me hope. It gives me hope to know that this is something that has been fought for a long time, and no one has given up before us, and we are the generation that won't give up either. So that's where I find that hope.
That's cool.
Have you ever considered running for like senator? You have a
Public office.
great way of speaking and a very positive and hopeful way. I just want to compliment you on that.
Well, thank you. If I'm honest, I have. I don't know senator route. Obviously, you got to start local.
Right. What would you run for, just out of curiosity?
My life, probably.
Is this been angling to take my spot on the podcast? This feels bad. Oh,
yeah.
If you ever do want to make an announcement, come on the podcast to make
yeah,
it.
please. We beg you.
Okay.
So one last question for folks out there. regarding the work that you all do, which is really important. If anyone needs help out there, how can they reach out or how can they connect us to you all?
Yeah. First and foremost, I would say if anyone needs help, you are not alone. We are here to support you. There's a few ways to directly get in touch with our program, to directly get linked with the CHW. You can go to our website, myfcph.org. We have a phone number, 614-525-4892, and an email at chw@franklincounty.ohio.gov. So those 3 routes will get you in direct contact with our program. You can also reach out to me directly. I'm happy to talk about CHWs, to learn from you, to share what we both know, to continue to advance this workforce. There have been, I will say, some times in the past where we've run into a wait list, and that wait list time for someone who has referred to us to be connected with a CHW has ranged from 2 weeks all the way up to about 8 weeks, which is a pretty long time. But we don't want that to discourage people from reaching out to us, because we can still help you get connected somewhere else in a more timely manner. And then once we've addressed that wait list, the CHWs are always available. So those are a few routes.
That's awesome. Great information. Before we bid you adieu, I wanted to throw it over to Zach to see if he had any final thoughts or any final creative whims that he wanted to share with us.
Yeah, so believe it or not, I've come up with a game for all of us to play. This is a game that I've had in my head for, I would know, say days to weeks, so I've been waiting to play it with you.
Excellent.
So, a lot of what you were described today, I would argue that, you and your team of CHWs are modern day heroes, superheroes even. So I would like us to go around the table and talk about if we could be a superhero, what power would we be, whether it be to help humanity or to stop crime. I'll start as an example. So my superpower would be that I would use the sun's light to brighten people's days, or in terms of stopping criminals, I would harness the power of the sun to blind them and then just clothesline them.
All right, so
Bank robbers beware.
Your superpower is to blind people. Angela, what about you?
Criminals.
Alleged criminals, yes.
I'm sorry, just trying to process that. I think that I would probably, I don't know, like be able to transform anything into food. I'm like always hungry.
You don't say.
Yeah, I don't know. Just and it'd be helpful for other people too. I mean, like, just kind of like make a pile of rocks a really nice pasta dish for someone. You know what I mean? Like, I don't know. So something along those lines. It's not really well.
I would have you make macarons for me, like out of whatever every day. Be like, macaron, please.
Okay.
Macaron.
Macaron.
No.
Okay.
No.
Fair.
I'm going to go much less of the helping of humanity route. I think that was, making anything into food, that can solve some problems in the world. I've already forgotten what you said, Zach. What did you say?
Something about the sun.
Using the power of the sun.
I'm sorry. Yours wasn't to help humanity. It was to blind people. All right. I'm going to go with flying. Flying is fun. I think it'd be cool to fly. Just to jump up and keep going for a while.
Where would you
get out of the way? I don't really care. Just fly around. Just enjoy it. It's something that humanity can't do.
So you've been given this power.
Yes.
And you're just gonna use it to fly around.
Listen, he just wants to be a modern day Amelia Earhart. Let him.
Okay, cool. Just wanted to make sure that you're not a hero. Got it. No, not a hero.
Yep. I wasn't going for hero. Devon, after listening to our foolishness, do you have something?
It's a tough one.
Invisibility is always a tried and true one.
That's cool. I'm trying to go with something like real deep and
what?
Yeah.
Well,
but then I'm also like, dude, just stop, say something.
Turning rocks into food was already taken, so you got to come up with something else.
I know that was as deep as it would get. I think that I would go with invisibility before I just get too far here.
Yeah.
No, I can't do invisibility.
I love this.
This isn't binding. You're not actually
binding. No, it's binding.
It is.
It is really
actually.
It feels really super binding.
It is. Yeah. This is a lot of people will hear this.
Yeah, let's go with invisibility.
Okay.
Just to ask you,
because then I could just disappear and get out of this and stop thinking about a superpower.
Perfect. Just really quick, you had said you had started on a track of get rid of.
Yeah.
What were you going to get rid of?
What
just
I
wanna
was,
know.
yeah, and this is where I was going with but see, I couldn't fully think this thought out, but I was going with get rid of all of the divisiveness and division
That's a
that's
good
created
power.
when people disagree. Like we can all two things can be true at the same time type of deal. Like we can all disagree and do it in a way that is healthy and productive and moves everything forward versus just tearing each other down in a really dark, hard world that's really hard already.
Well, I like that. I wish you went because the the superhero name you like the human connection. Whatever. Like you just. But that's what CHWs not that exact form of it, but CHWs are all about, in my experience, connection. You guys connect people to services, connect them to better times and everything. That fits so much within your nature. I think that's a great answer.
And they can fly.
And be invisible. And when
and
it
they can fly too.
Yeah.
Don't forget about that.
And fly, yeah. And if it doesn't work out or you can't make people forget their differences, then you just go invisible and just be like, I'm out of here.
You can have both. There
You
go.
can have both.
The superpower of unity and invisibility.
Yeah. But I couldn't really think. No one's ever going to fully agree. It's just not. It's not reality. But how do we do it in a productive way?
Yeah.
I love that.
Yeah.
Absolutely. Devon Abdon, Care Coordination Supervisor here at Franklin County Public Health. Devon, thank you so much for coming on the podcast today.
Yeah, absolutely. Thanks for having me.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.